Subscribe the channel and ring the bell. Hello friends. Welcome back to the channel Nursing Medicos. Now this is part 3. Part 1 2 already we discussed. I will give link below the video so that you can watch there. So those are new, please subscribe the YouTube channel so that you can get my all upcoming video. You will not miss any video. So I will start part 3 DHA MS Prometric hard exam questions. Question number 41. A patient came to the emergency department with coughing and difficulty in breathing. You suspect patient has asthma attack. The sound you will hear, which sound you will hear in that condition? Option A, wheezing, B, chronic, and crackles. So, wheezing is the right option. 42. Upon assessment of an obese patient back, the nurse observed a forward curvature of the lumbar spine. Forward curvature lumbar spine. Okay. These findings are indicate of kyphosis, B, list, lordosis, and sclerosis. So answer is C. This is lordosis. 43. A 30-year-old man is brought to the emergency department by a friend with whom he had been playing football with earlier that evening. His symptoms comes on after 20 minutes of the football match. He appears anxious and restless. Auscultation of the lungs reveals wheezing. The patient stated that he is unable to get a full breath of air. He had this problem as a child a couple of times after exercising in cold weather. His blood pressure 26 by 72 mmHg, heart rate is 90 per minute. Respiration 28, temperature is 37 degree. Then oxygen saturation is 94. On room air, which position is the best for the patient? A, supine, reverse tenderbar position. Option C is prone position. Option D, high Fowler's position. We have to give high Fowler's position. We'll move to next question 44. A nurse is caring for a patient who has just had a chest tube attached to a water drainage system. To ensure that the system is functioning effectively, the nurse should A, observe for intermittent bubbling in the water drainage, B, flush the chest tube with 30 to 60 ml of anus every 4 to 6 hour. Option C is maintain the client in an extreme level of position, and D, strips the chest tube in the direction of client. So answer is A. Next is 46. A patient on a medical floor is diagnosed with pneumonia. Which of the following intervention is appropriate for a nursing diagnosis of ineffective airway clearance related to tracheobronchial secretion secondary to infection? So for that, option A is explain diagnosis procedure, address any of patient concern. B, assess patient for sign of discomfort and pain. Option C is monitor oxygen therapy and encourage the cough and deep breath. Option D, monitor patient for shock. Also, our answer is C. Next one is for 47. A patient with bacterial pneumonia reports increased pain during deep breathing and coughing exercise. To minimize the patient pain, the nurse should teach the patient to. Option is take the cough suppressant prescribe PRN at regular time intervals. B. Turns on to the side before doing the respiratory exercise. C. Hold a pillow tightly against the chest while coughing. Option D is drink warm liquid right before taking deep breath. So our answer is C. Hold a pillow tightly against the chest while coughing. Option is 48. A patient with history of chronic or COPD disease prepare for colonoscopy with sedation. Due to the patient history, the nurse should very caution about give administering. Option A antibiotic, B sedation, C oxygen. Option D is intravenous fluid. So answer is C. We have to give oxygen. Question number 49. A patient home care patient with chronic COPD reports an upset stomach. The patient is taking theophylline and asthma cot. The nurse should instruct the patient to take. So for that answer is D. Theodore with milk or crackers. Question number 50. A nurse is assessing a patient who just had surgery under general anesthesia. A patient respiratory rate is 4 per minute and the oxygen saturation on 3 liter per minute of via oxygen. Oxygen via nasal cannula is 84%. The nurse is awaiting the result of arterial blast ABG. Anticipate that patient. Which of the following will be elevated? A. Arterial oxygen saturation. B. Hydrogen pH. C. PaO2 partial pressure of arterial oxygen. Option D. Partial pressure of arterial carbon dioxide. Option is D is right. Okay. Next one is a patient present with pneumonia. Which of the following interventions would the nurse implement to improve the patient's gaseous exchange? The heart rate is 80 per minute. The respiration 32 per minute. Temperature is 40 degrees centigrade. Option A is encourage the patient to increase fluid intake. B. Position the patient in upright position. C. Instruct the patient to sprint with coughing. And D. Applying heat and cold to the chest as orders. So we have to encourage the patient to increase fluid intake. Next one is okay 53. A nurse is giving instruction to parents to perform chest physiotherapy CPT on their son with pneumonia. The nurse has parents place their son in prone position. Okay, this we can see patient prone position with their body tilt downward before performing CPT. We can see this position, patient is in the prone position and head is down. Based on this information, the nurse gave instruction to the parent to remove drainage from which of the following janglobe segment? A. Upper posterior, B. Lower anterior, C. Lower posterior, and D. Upper anterior. So answer is C. Lower posterior. Question number 54. A charge nurse enters the nursing diagnosis. Risk for ineffective airway clearance related to inability to swallow. On the client care plan, which nursing intervention is the most appropriate for managing the identified problem? A. Keeping the patient in supine position. B. Removing all hairs pillows. C. Performing oral suctioning. D. Provide frequent oral hygiene. Answer is C. Performing oral suctioning. Okay, next one. Which of the following intervention would the nurse implement to enhance the patient airway clearance? Heart rate is 80 per minute, respiration 32, temperature is 40. Option A, give oxygen, maintain comfortable position, increase fluid intake. D, administer analgesics. So we have to give increase fluid intake. Option C is right option. Next one. 56. A 7-year-old client is brought to the ER. His trachne he is tachypanic and febrile and has a respiratory rate of 36 per minute and a non-productive cough. He's recently had a cold from his history the client may have which of the following: acute asthma, bronchial asthma, COPD, emphysema. So our answer is acute asthma. The next one is the term blue blotters refers to which of the following condition? So answer is C, COPD. Okay. Next one is a nurse is suctioning fluid from a client via tracheostomy tube. Which suctioning? When suctioning, the nurse must limit the suctioning a maximum of 5 seconds, 10 seconds, 30 seconds, 1 minute. So 10 seconds. Okay, maximum 10 seconds. Okay, next one. Following picture, we can see this picture. Okay, suggest patient has renal disease, hepatic disease, pulmonary disease, or cerebral disease. So we can see this finger. So in this condition, this disease. So patient has pulmonary disease. So this is the about all respiratory questions. So in the next video we will discuss other systems questions. So keep watching Nursing Medicos YouTube channel and subscribe, hit the bell icon so that you can get my all video notifications. Thank you so much.